I was 14 years old when I was first prescribed hydrocodone. 14 years old. I wasn't even legally allowed to operate a vehicle, and yet I was prescribed hydrocodone. Yes, it was for my wisdom tooth surgery, which is very painful. However, hydrocodone to a 14-year-old girl, I don't think that's necessary. Us as Americans, we do not pay enough attention to the opioid epidemic that is among us in America right now. We don't pay attention to the addiction levels of opioids. We don't pay attention to the death rates correlating to opioids. We don't talk about the opioid crisis that's in front of us right now. We are going to discuss what an opioid is, different types of opioids, how it's classified. We'll discuss why it's prescribed to patients. We will discuss the addiction levels and the death rates correlated with opioids. To begin, an opioid is a a Schedule II drug. This means the substance is approved for medical use in the U.S., but may have strict limitations. There is a high likelihood of abuse, and there is a risk of developing a severe physiological addiction to substance. Leah Miller, 2022. Opioids originate from the opiate plant. Back during Civil War time, they found an opiate plant, and they started injecting this into their soldiers when they would come home with illnesses, injuries, because obviously they were feeling a lot of pain and medicine was not very common back then. They started to inject opiates into these soldiers, and they learned that the pain would go away. This is because we have pain receptors in our brain. When the opiate travels up to the pain, it blocks the pain receptor, so you don't feel the pain anymore. Opioids are the same thing. They're synthetically compounded in a lab from the opiate plant. Moving on, we're going to discuss why opiates or opioids are prescribed in a medical setting. A lot of the times people have chronic pain, chronic neck pain, chronic back pain, maybe from an injury or in a car accident, and so they are prescribed opioids to help deal with that pain on a daily basis. A lot of the times what patients don't realize is that opioids are very addictive, because once you block that pain, you want to keep taking the medicine to not feel the pain anymore. Also, after surgeries, opioids are often given to help deal with the pain after a surgery, but this also comes in, they also give the physical therapy as well. But opioids can then become reliant. They can become reliant on opioids because it helps deal with that pain. Different types of opioids. You have hydrocodone, oxycodone, and morphine. Everybody probably has heard of morphine. That is generally what's given when an ambulance shows up. They can only give you a certain amount of dosage to deal with the pain on the way to the ER. A form of oxycodone would be Percocet. I'm sure a lot of you have heard that. And a form of hydrocodone is Vicodin. So doctors tend to prescribe opioids when they have a patient dealing with pain. They generally just ask them where the pain is. Have they tried different methods? If the patient just complains and they can't do regular daily activities, they will give them a specific type of opioid to deal with the pain. Moving on, we're going to talk about the prescription rates in America. As of 2022, by the CDC, there were 142 million prescriptions for opioids. That is nearly half the percent of our population on opioids. It's 43%. So almost 50% of our population has been prescribed opioids. Of those 142 million people prescribed with opioids, we have 10.1 million who reported they misuse their opioids. This can be known as a drug disorder or a drug use disorder. That can be classified by the National Survey on Drug and Use Health as 1, without a prescription given to the respondent, so you're using someone else's prescription for the opioids, or 2, greater amounts of the drug or for a longer amount of time than they were told to take, or 3, using it in another way that the doctor did not prescribe it to them as. So you have 10.1 11 million people misusing this drug, whether it be they're using someone else's prescription, or they're taking it for longer than they're supposed to, or they're taking too many at a time than they're supposed to. Taking too many at a time than they're supposed to is very dangerous, because Carrie Krieger from Mayo Clinic, she explains that when you take too high of a dosage of opioids, your heart rate will slow down, your breathing rate will slow down. This is oftentimes what leads to an overdose, which then kills you because your heart can stop. You can stop breathing from taking too high of a dosage of opioids. As of 2021, there are 78,000 overdoses on opioids. 78,000 people died from overdosing. I think as an American society, we do not pay attention enough to how many individuals in America are prescribed opioids. We don't shed light on the fact that we're taking opioids to cope with pain versus other methods. And we have lost 78,000 just within the last year because of an opioid addiction. We need to take a bigger look into the opioid epidemic and find out why we're so willing to give prescriptions to such a dangerous drug, such a high addictive drug. We don't pay attention to why it's an addictive drug. We don't give different options when people are dealing with pain. Us as Americans need to come together and look at this opioid epidemic and see that this is an issue and that it should not continue. The next time you're looking around, look at your neighbors, look at your friends, look at your family. Maybe they're dealing with an addiction too. And maybe it's our job to help them to fight this addiction so that they can get back to their normal lives.